Okay, here's a question for you. If you were going to nail something into the wall, would you just put your finger up there, close your eyes and hammer, or would you measure before you did it? Hopefully you'd measure before you hammered away. Dr. Nick Circolone is here from Apple Physical Medicine and Rehabilitation. That was my analogy, if you will, for your topic today. Good to see you, first of all.
So, good seeing you.
Because if you are looking to do something like the PRP injections people have heard about, hyaluronic acid, you know you're going to need help, quote, in your knee. That's still a pretty good bit of space. What you're doing in the office is you are not closing your eyes and hammering away. You're pinpointing first.
Exactly. You know, it's funny, you said, you know, closing your eyes and hammering a nail. We're actually using the stud finder to find the stud.
There you go.
So what's happening is we're actually, we start out with an arthrogram. We'll use the knee as an example. We're using an arthrogram. We're injecting a little bit of dye so we can see where the fluid's going to go. Sometimes in a knee, we don't know that. There could be scar tissue in there. There can be osteophytes or bone that's in there that we can't see, that we may hit, may inject our medication into that area. But by using that arthrogram, we're able to see where the fluid goes so that when we put the medication in, we now know it's going in the right place. So we're getting more bang for the buck that way.
So what does that feel like for the patient, though? This pre-test that you do, if you will, are you injecting something into the knee first? How are you discovering what's in there? We're
using a dye called IsoView. So what's happening is as we inject the dye, we're just seeing a little bit of that space. Now, most patients can deal with the dye, and we use a very small amount.
And how are you seeing it? I don't mean to...
Oh, on the fluoroscopy unit. In other words, we have a machine.
Okay.
It's basically an X-ray machine that we can see where the fluids are going.
Do you see it in real time?
You can see it in real time, but we take short little burst pictures. We don't want to keep that machine on too long because it is radiation.
Okay.
So we're looking at it in bursts. So if somebody's had, a good example, if somebody's had an epidural steroid injection, they use a fluoroscopy unit or a C-arm. We have a mini C-arm in the office that we use.
Okay. Now you just said earlier, let's assume that you're having this done in the knee.
Yes.
That is not the only way you can use these PRP injections and hyaluronic acid?
No, we can do it in the shoulder, we can do it in the, even for plantar fasciitis, we can actually do it in the elbows. Most of the joints we can do it in.
How do you know if you're the patient? I guess you're going to tell me that you come to see you and you can be the one to guide, but how do you know if this is going to be beneficial to somebody? What are you looking for?
Most patients that come into the office already know that they have a problem. So now they're looking for a solution or a treatment for it. A good example, I've had patients come in that say, oh, I have bone on bone with my knee. Well, when we do an x-ray, it's not necessarily bone on bone, but it is pretty close. And sometimes if we use a hyaluronic acid to help rebuild that cartilage, it does help. There's different types of medication that we can use. The medication we use is called Suparts. It's a 5-injection process. So now we're getting a longer lasting, I think, viscosupplementation in the knee, which is going to help the patient over the long term.
So people will come in and for 5 visits, they will have an injection?
Yes. Now we only do the arthrogram one time, but we use the fluoroscopy unit every time to make sure the needle got it into the right location.
And is that true as well if it's a plantar fasciitis issue versus a knee issue?
Plantar fasciitis would have to be a little bit different. We can actually fluoroscopy the ankle and the foot, but usually you can feel for the plantar fasciitis. It's a little bit different.
So we talk about this quite often when you're here because it has become something that's almost table vocabulary. Most of us have heard now about PRP and hyaluronic acid. It still is interesting to me though how it actually works. So if somebody comes in and they are close with that bone-on-bone pain, do you have to look at a series of things about their health before you make a decision whether that's the best course of action for them versus, say, maybe going ahead and doing a surgery?
One of the things that we do, let's say you come into the office and you just have x-rays, or you have no imaging, we'll at least start with an x-ray. If we find out that you're either a grade 1, grade 2, grade 3, or grade 4, and from there we determine what we want to do. If you're a grade 2, usually the hyaluronic acid injections work fairly well. If you're a little bit higher, 3, maybe 4, we're going to do an MRI. We want to see what's in there. We want to see what the soft tissue looks like as well. Because when we look at it under fluoro, we're only seeing hard tissue. We're not really seeing anything of the soft tissue. We can extrapolate that, yes, there's soft tissue irritation, soft tissue damage, but we cannot see the soft tissue. So what we do then is we'll do the MRI, and then we determine, do we want to still do a hyaluronic acid or viscosupplementation? Do we want to do PRP? And in some cases, we'll talk about doing stem cell. But everything is always guided, so we know where we're going, where the medication's going to lie. And a lot of people have had these injections, and they've had it done blindly,
right.
even up to even stem cells.
And you're talking, we're going to have to wrap things up, but you're talking a pretty significant amount of money, especially once you get into the stem cell part of the
Right.
conversation. So aren't you pretty open with that, about that with your patients, and you don't want to have them spending money unnecessarily?
Absolutely. Now, your hyaluronic acid injections are pretty much covered by your insurance companies. When we start looking at PRP, the PRP procedure is not. But there are other things that we do in the office that offset, like the fluoroscopy unit we can cover, the exam we can cover. So they're actually just paying for us to draw the blood and put the serum back into the joint.
I know one of the things you love so is that when people call the office, well, you love lots of things, but when people call the office, they do get a real live person.
They do.
So is it helpful for them to kind of explain a little bit about what their need is to help give you some notes before making the appointment?
Absolutely. You'll call the office and you'll talk to one of the ladies at the front desk, whether it be Gina, Shay, or Alyssa. And what happens is if there's something that they can't answer, they'll say, hey, if you give us some time, Dr. Circalone will call you personally and you can talk to him. So I may not call you directly right away, but I will call that person that day.
You might be a little bit surprised because he is very much a doctor who is in touch with his patients, and he will want to get to know you and let you get to know him. You will find his office on Shallowford Road, also a satellite office in Sale Creek
Yes.
as well. One day a week you're there?
Yes, one day on Tuesdays.
In the meantime, the phone number is 855-7376. AppleRehabGroup.com is the website. It's a happy place to go visit. Great to see you, Nick.
Good seeing you. Thank you.